Okay, so this is my final project on acute diarrhea caused by Clostridium difficile. So the signs and symptoms. Signs are going to be fever and leukocytosis. Symptoms are going to be severe diarrhea, stomach pain, anorexia, and nausea. Then we have the causative agent. The causative agent is the bacteria Clostridium difficile. Scientific name is also Clostridium difficile. It can also be called C. diff or C. difficile. Cell shape is rod-shaped and it is pleomorphic. Cell aggregations can occur singly as diplobacilli in pairs or streptobacilli in short chains. More on the causative agent. There are no external appendages in Clostridium difficile. Flagella are present and distributed as peritrichous. Type 4 pili are present. Surface layers, it does have them. It contains an S layer, also contains a cell wall, and it does form endospores. Pathogenesis and virulence factors. First, pathogenesis. The portal of entry is going to be the gastrointestinal tract or the GI tract. Type 4 pili allow for direct adherence to host tissues, and the pathogenesis is going to be microbe-mediated pathogenesis. Virulence factors, it produces toxins TCDA and TCDB. Both of those toxins cause damage and inflammation to the cells. It also produces a binary toxin, which helps it adhere to host tissues. Other virulence factors include Fimbriae, capsule production, and secretion of hydrolytic enzymes. Diagnosing the infection. So signs and symptoms used to diagnose are going to be experiencing watery diarrhea many times a day, blood or pus in the stool, dehydration, and intestinal inflammation. Tests used to diagnose, the most common test is going to be a stool test. So with that, the doctor can perform a polymerase chain reaction test to look for the gene for the toxin, for the B toxin. You can also do a physical examination of the colon. And lastly, an X-ray or a CT scan can look for inflammation and perforations in the colon to detect infection. Ways of transmission. C. difficile is a communicable infection. Transmission can be direct. So with that, if one person deals with an infected person's feces and such, or it can be indirect through fomites and water or soil. Epidemiological data. So prevalence, incidence, and mortality rate. The prevalence, C. diff has become more prevalent over the past few years, like recently. The incidence of this disease has risen to become the most common healthcare associated infection. The mortality rate is 1 out of 11 people will die from C. difficile. The pattern of disease. C. difficile is characterized as an epidemic. The infection rate is rising around 10% a year, and the mortality rate is rising even higher, so more than 10% a year for the mortality rate. Prevention. So vaccine for C. difficile. There's currently no vaccine for this disease, but there is one that is in the works being researched on. There are vaccines being worked on with hope that the toxins that C. difficile produces, that being the A and B toxins, may help to create a working vaccine. Researchers have worked on activated and inactivated vaccine. So prevention recommendations, wash hands with soap and water to kill the pathogen. And it's been proven that prebiotics may help prevent contraction of this disease. Treatment. Treatment does utilize antimicrobial drugs. The antimicrobial drug used for this disease is antibiotics. Two examples and their mode of action. So vancomycin inhibits cell wall synthesis, and fidaxomicin, its mode of action would be inhibits bacterial RNA polymerase at transcription initiation. Other treatment, it does not use passive immunization. And symptomatic therapy can sometimes be useful if the infection presents as a recurrent infection, but it doesn't always present as a recurrent infection. Antibiotics and probiotics can be used to stop recurrence, but may not always work. And that's the end. Thank you.